Hey everybody, how are you all doing today? Dr. Rob here. Another great day. It's beautiful outside here in New York. We got a lot of sun, a little cold. Just wanted to see how you're doing. We've got a lot of great information. I mean, more and more interesting studies are coming out. You know, initially when this health pandemic started, it was all information pertaining down one lane. Now we're kind of getting other lanes and we're seeing a whole bunch of different things. And that really speaks to what I said today. What does a sauna and exercise have in common? And we're going to cover that. We're also going to go over why in this health pandemic, in coronavirus, COVID-19, that it can affect the heart. It's very interesting when you see how it affects it. So we're going to cover all that, answer all your questions, always answer your questions, always give you a great shout out. Looking forward to your shout outs. Looking forward to your questions, and I'll get my laptop up in a second and I'll start looking, and we'll get to that. But just to start, I hope everybody is doing everything that they're supposed to. Once again, let's do the physical distancing. Once again, let's remind everybody to eat healthy. If you have any problems or you have any options, there I did it, I touched my face. If you have any issues or any problems, again, feel free to reach out to me. So we're going to get that cooking now. And we're looking forward to seeing people who join. Again, exercise every day, at least 20 minutes. Yesterday, you know what? I exercised. I haven't missed a day. I didn't do a long period of time. I just did 30 minutes on a treadmill and I did my mobility. It wasn't an hour and 15 minutes. No, I'm not working out 2-3 hours, even though we theoretically have the time. I think I'm busier now than I was prior to that. Having said that, there's some interesting things here in that there's a great article in Business Insider. I have it right here. I decided not to put it up. Hey, Mike, how are you? You're a little late to the party. In the article in Business Insider, it speaks about a sauna. That's the one thing I don't have in the house. We were just discussing it. We're probably going to get a sauna in the foreseeable future. So the Business Insider does a great job. It says, taking regular saunas seems to transform your health. It's more evidence there could be a third pillar of physical fitness beyond diet and exercise. Well, everything starts in your pillar of physical fitness with diet and exercise. But the sauna is interesting in that this was a study done in Finland. And it said people in Finland regularly take saunas where they go into extremely hot, dry rooms for short periods of time. The more saunas people take, the healthier they seem to be, according to a new medical review. Hey, who would have known? Health benefits of exposing yourself to extreme heat include improved heart health, mental health, immune function, and much more, which we will go in more detail. And in addition to that, there's also significant evidence that exposing yourself to cold temperatures improves your health. So who would have thought a sauna? Now, obviously, if you don't have one in your house, you're not going to be able to go anywhere. But in the future, when we come out of this, and you've seen me say every day that we're going to come out of this, we will, without question, start considering different ways to keep ourselves healthy. And one of those ways seems to be a sauna. In addition, this is in reference to sauna. It was cited in the article. This is from the Journal of the Mayo Clinic. And it said that saunas enabled lower rates of cardiovascular disease, decrease your blood pressure. These are all comorbidities of COVID-19. Decrease your incidence of lung disease, decreases your incidence of cognitive disease and mental health. Well, the mental health, you're probably about ready, being cooped up 30 days or 3 days. Your mental health definitely adversely affects you. But when you look in cognitive disease, I don't think the brain has been spoken about enough in this health pandemic, because we know that the gut is injured and the gut and the brain are intertwined. So I think we're going to see some issues with the brain. The studies just haven't come out. Everything's new. It's novel. But when you look at it, lung disease, blood pressure, cardiovascular disease, and such, it lowers the rates. Clearly, if you're fortunate enough to have a sauna, you're without question going to have some health benefits. The premise behind it is the hot temperature gets your blood pumping and gives you a better quality of life. So what does sauna and exercise have in common? They get you to pump your blood. They get you to circulate your blood. What's the proper temperature in a sauna? The average is about 200 degrees, and the time frame is anywhere from 5 to 20 minutes. So Maria, I see that you said, can you send the link to the article? I will definitely send the link to the article I'm even going to give you a like right now, just to let you know. And hi, Cole. How are you? Hey, Dave. Pleasure that you could join us. I greatly appreciate it. Dave's a good buddy of mine. And Dave, yes, I drank your coffee this morning. We're due to grind up some more. So we'll be giving you a call momentarily. So we talked about the sauna and the heat. Interesting. What about cold? Everybody's loves the new baths, those cold, those freezing baths and everything. Well, the literature is interesting in that it really shows that going into that extreme cold enables you to burn fat. It gives you better body composition. It improves your immune system. So now we're seeing the change from hot to cold and cold to hot. What we found out is you don't want to always stay in the same temperature of 68 to 72 degrees. You want to vary your temperature. You want your body to adapt to new stimuli. When it adapts, it has to produce more immune system. When it's steady state, it doesn't function as well. That's right, Mike. Organic coffee all the way, without question. Organic coffee. Don't take the pesticide coffee. It also helps you transform the type of fat that you form in your bodies to a healthier kind of fat. It's actually not only you're losing fat, you're getting more of a metabolizing fat going into cold. So clearly, the nitrogen tank is really hard to keep in your house. You're probably going to have to go outside for that to one of the facilities. That doesn't pose a problem when that happens. Having said that, clearly you want to change your temperature. You want to change your temperature between hot and cold. Really immune boosting, really good, decreases your incidence of comorbidities. How about brown fat? The cold promotes turning fat into brown fat? Absolutely, it does. Good question. Let me give you a like there. I'm having a lot of fun now that I'm using my laptop. This is too much. These middle-aged guys on this social media and everything like that. Brown fat? Yes, brown fat. It's like in there. So brown fat. So let me get to my exercise over here, and then let me answer some questions. So interestingly enough, in reference to the exercise, I have it right here. They said, why does exercise so promoting and good and protecting against deadly complications? And why the actual article is a single session of exercise increases the production of a critical antioxidant extracellular SOD, superoxide dismutase, helping to reduce the effects of COVID-19 infection. That is in neuroscience.com. So we can post that one also if you really like. Basically, the summary here is regular exercise may prevent or reduce the severity of ARDS, which is acute respiratory disease syndrome for those with coronavirus. A single session of exercise increases the production of an antioxidant called, once again, superoxidase dismutase, or extracellular. It helps reduce the effects of COVID-19. And it goes on to say, regular exercise may reduce the risk of acute respiratory distress syndrome, a major cause of death in patients with COVID-19 virus, a type exercise researcher reports. He actually urged people to exercise based on his findings, which also suggests a potential treatment approach. So, wow, what does sauna and exercise both have in common? Well, one, not only are they health promoting, two, they promote circulation, and each of them functions a little differently. However, the exercise kicks up your antioxidants. We haven't talked about that enough. We have all these free radicals. We're sick. Antioxidants are a critical element. So obviously, everybody should take that opportunity to go exercise now. A couple of articles I also read yesterday was fascinating how people came in because they were concerned about having COVID-19, weren't showing symptomology, yet they had gut distress. So it's an early indicator, gut distress. Not everybody who eats something bad or a Dorito and has to use the lavatory a few more times. Distinct gut distress. One of the studies spoke to the idea of they did a CAT scan and they looked in the gut and they went up a little too high mistakenly, and they saw the bottom of the lungs, and in the bottom of the lungs, what they saw was they saw some of the fibrosis, and sure enough, 2 days later, that person had a fever and was positive for COVID-19. On the other side, or conversely, if you will, that 53.4% of people who were tested for COVID-19 had the virus in their intestinal tract. More so than that, when they became negative, 23% had the virus. We spoke about that yesterday. The shedding of the virus can take up to 2 weeks after you're negative for the PCR test. And that's why the antibody test is so important, because the antibody test is truly going to let you know your status of antibodies and where you are. So if you're interested in an antibody test, we talk about it every day, let me know. That's right. Endogenous anti-inflammatory is 1,000 times stronger. Hey, Siriwan, how are you? How's everything going? Got a nice little shout out from California. I hope you didn't just wake up. Hope all is good. So again, I'll be on a webinar today at 4 o'clock. And in that webinar at 4 o'clock, if you guys are interested, I can give you a link for that also. We're really going to talk about genetic markers or genetic dispositions. So it's interesting that people have a genetic disposition, so they don't have any of these comorbidities that we talked about. They're healthy looking, yet they get a terrible coronavirus. They're awful, they're sick. Some have even gone on respirators, and in rare occasions they've died because they have a genetic disposition to damage in the respiratory tract. They can't process their interleukins. So if you're interested in that, and I'll do some Facebook Lives on that. We'll be sharing that soon. Hey, Mitch, how are you? Great that you could join us. I'm happy that you're here. In addition, we've talked about the ACE2 inhibitors or the ACE2 receptors. These ACE2 receptors are common on mucosal linings. So we all know about the ACE2 receptors in the lung. We've talked about that. This particular virus loves ACE2 receptors. It's able to take its triple spike dimer, get in there and get in 10 times tighter than any other virus previously seen. So it tightens tight. It causes a whole bunch of macrophages, neutrophils. The body reacts with more cytokines eventually compressing the lung, and obviously people can't breathe. A lot of people die from cardiac arrest because they're having trouble breathing, and there's a tie to the heart. But there's other ties to the heart. Don't forget, even before the heart, those ACE2 receptors are on mucosal linings. It's on the gut, it's on the liver, it's on the kidney. Hey, D. Lawrence, what's the cost of the test? Do you have to fill a form out? What we'll do is we'll give you a link to everything. We can take care of that. We'll give you a link. We'll put a link up, and then you can do the test. Of interest to the antibody test. Hey, Malia. I'm happy you could join us. Malia from Waconia, my favorite laser. Everybody knows about it. You know, a couple of people have asked me, and I think we're going to do a Facebook Live. In that, we're going to do a Facebook Live on the laser and how it can possibly help the immune system and things of that nature. I'm going to answer a few questions. Pierre, is it true that you have blood type O? It's very unlikely you get the virus. Well, blood type O doesn't mean unlikely you're going to get the virus. It means you have a better chance of not getting the virus, and not getting the virus as virulently as if you were type A. Hey, Mitch, any concerns with clients on beta-2 agonist like clenbuterol or inhalers? Yes. So here's what I'm hearing, and here's what I'm saying is it does give you a greater chance because let me rephrase that. So essentially, that if you have a blood pressure or you're doing an ACE2 antagonist, it does increase your incidence and your ability to get COVID-19. They did say if you're on prescription medication, not to stop it. So that's a question that always comes up. That's a great question. You know, it's interesting. Also, before we really get into the heart, how many people ask me about the different supplements? And the supplements, you know, we've done a couple of Facebook Lives, but the supplements are now changing. So things that you didn't think were as important have now come to the forefront. So again, as we all know, guys, elderberry, go for it, no problem. One article, it was misstated, misquoted. Have no fear with it. Your vitamin D, take your whole way through. That's another thing that's come to the forefront, believe it or not, has been some good studies on alpha-lipoic acid. Alpha-lipoic acid works with the water and fat part of the cell, great for blood glucose modulation and metabolism, a very, very potent supplement. Something else that I haven't talked about a lot is oregano oil. Oregano is great because it gets rid of bad bacteria in the upper respiratory area. By getting rid of the bad bacteria, or if you will, lung dysbiosis, you'll have a stronger lung lining. Any of our barriers that are stronger give us the ability to have better health. Melatonin, you got it, my man. Melatonin decreases that cytokine storm. 20 milligrams of melatonin. There's a great article in, I think it's Med Science Life of March 20th that really talks about melatonin. We've posted that one before. Let me give you a like over there just for that. Hey, Laura, how are you? How about nebulizing? You know, I got to tell you that I don't do any nebulizing, so I can't really speak to that. I think it's a fabulous question. I'm going to get some of my other colleagues to give you a like on that and let you know about that. But for me, I don't know. Just checking for any more questions. Hope you guys are having a good time. Please continue with those shout outs. Thanks for encouraging me and telling me that every day, Monday through Friday, they appreciate it. It is hard to find all the info, but we're reading articles every day. So I want to go through this article right here. It's the European Society of Cardiology. And if you need the link, we can share the link. The ACE2 expression in the human heart indicates new potential mechanism of heart injury among patients infected with the SARS-CoV-2. So I'm going to go through this point by point. This is a huge anatomical takeaway. Hey, Dr. Fadi, how are you? My man, how are you feeling today? A new type of pneumonia is caused by novel coronavirus, SARS-CoV-2 outbreaks recently in China. We all know about that. Its disease name is COVID-19, infects many different people, and nearly 20% of the patients develop severe conditions. Cardiac injury is a prevalent complication in severe patients, exacerbating the disease and severity in coronavirus patients. As we all know, ACE2, you're welcome, Maria, ACE2 enzymes, the key host cellular receptor of SARS-CoV-2 has been identified in multiple organs, but its cellular distribution in the human heart is not illuminated clearly. So they knew it went to the heart. They assumed it was the outside of the cardiac muscle. Listen to this. This is amazing. The study performed the first state-of-the-art single-cell atlas of a human heart and revealed that the periocytes with high expression of ACE2 may act as the target cardiac cell of SARS-CoV-2. So it's the blood vessels inside the heart that has the angio2. It's not the actual cardiac muscles. So that leads you to, wow, a whole different ball game as things start to evolve and things start to uncover. It's unbelievable that it's the periocytes in there. The pericytes injury was due to virus infection, may result in capillary endothelial dysfunction, including microvascular dysfunction. With that, the patient's basic heart disease showed an increased ACE2 expression at both the mRNA and protein levels, meaning that if they are infected with the viruses, the patients may have a higher risk of heart attack and critically ill condition. This explains why COVID-19 can damage the heart. They now have the mechanism. I don't know what the answer is going to be. I think the answer is a couple of fold, not necessarily for the endothelium or the periocytes in the heart. I think it's superfold in that, one, we want to keep it away. We want to be an unhospitable host, as we said, because we can't control the virus. We can only control the host. Having stated that, we want to do all those immune boosting supplements, those lifestyle changes, drink your organic coffee, exercise and such. In addition to that, if we get it, we want to continue to supplement and take care of ourselves and adhere to all of what our doctors recommend and things of that nature. Great little takeaway, like to say it every day. Really good outcomes. I see that there's a question. Really good outcomes in the ICU when they're injecting intravenous vitamin C and vitamin D. Hey, Christian, would it mean that nicotine, which has been shown to decrease ACE2 receptors, actually could be positive? I would say no. I'm going to ask a couple people on that, but I would say no. I don't see how nicotine is going to give you a positive outcome in health, so I'm going to have to say no on that one, but you get a big like on that one anyway, because thanks for asking a question. I appreciate it. So again, every day we're here. Before we sign off, some really good questions. I get a lot of questions mailed in later. I get a lot of DM. Like I said, everybody can DM me, direct message me. I'm always happy to answer the questions. One question yesterday was, give me 5 things that you would do if somebody's doing nothing other than social distancing. And I thought that was a great question. So 5 things. Number 1, start eating healthy. Don't fry your foods. You've heard me say this before. Eat the whole foods. Eat your fruits and vegetables. Go more plant-based. Diet. Food is a potentiator for inflammation. It's also a potentiator for inflammation. Food speaks to your cells. We want to give ourselves a good health signal. In addition to that, exercise. It's one of the two things that you can do. You can go shopping outside and you can exercise outside. Exercise. Walking's great. Home exercise. Get an online 8 Weeks to Wellness. Dane Donahue does a great job. You can check it out with Veronica Hope. I would strongly recommend that. In addition to exercise, hydrate well. Consider hydration. Hydration is a critical element. Lord, that's good. I know I got my voice. I couldn't talk to someone last night because I lost my voice, so I've been battling that, and I'm just talking too much. A lot of my friends are happy that I'm quiet. But hydration. Hydration is a critical element in that you want to have half your body weight in water and add 8 ounces for every 20 minutes that you exercise. Sleep. I can't emphasize sleep. Sleep is a recovery for all your systems, including your immune system, and your brain detoxes of sleep. And 5, let's get some good quality supplements. Good quality supplements like vitamin D3 5000 with K2. We've talked about that. Or vitamin C, L-glutathione. You can pick from your cabinet. I just had a whole bunch of people call me up, and today I gave them a whole bunch of gut powders with L-glutamine, okra, apple pectin, alpha lipoic acid, fish oils, things of that nature to help your gut, take care of your gut. So if you do those 5 things, hey Claudia, great to see you, I think that you're going to have a better outcome. And I think what's going to happen is that, I think healthy people respond better. Lauren said that, and they heal well. So I believe that if we keep our barriers up, and our barriers are skin barriers. So there's 3 points to our immune system, if we're going to just quickly go over that. It's our skin barrier, and then we have an innate immune system, and then we have an adaptive acquired immune system. If all 3 are in tow and in balance, you're going to be an inhospitable host. Again, some things that I'll be sharing with you later in the week, very simply, I'll be sharing you with tomorrow some genetic predispositions and some ideas where to go. Always have the antibody test. Feel free to reach out. You guys are doing a great job. I see you giving a summation. I appreciate it. Diet, exercise, hydration, quality sleep, quality supplements. Hey guys, what do you think of Creator? How about chiropractic care? Chiropractic care also. We may not be able to see you in person, but there's a lot of telehealth and a lot of telemedicine. If any of my patients are listening now, we're really busy with telehealth and telemedicine, a lot of nutritional consults. Yes, chiropractic. We're able to help you. I'm able to assess over the computer. We send you a lot of different exercises. People have found that real helpful as they self-isolate. And you know what? I'm here for you. It's been a pleasure. We've done our 22 to 23 minutes today. I'd like to keep it under 25. Again, if you have any questions, I will answer them. Resveratrol, absolutely. Resveratrol is an excellent choice. I'll give you a little like there with your resveratrol. I'm just having a good old time here with my social media. I like the resveratrol. It causes a positive feedback. Like a whole list of vitamins. We can go over that really quick on one of the Facebook Lives for viral replication. And I hope you find this interesting. Please share it. Press the share button. We put a lot of work into it. We take the time. We've got everything going. Share it with everybody. If you've got any requests, feel free. Give me a shout out. Dr. Rob, signing off. Always yours in health.